Good afternoon. Worcestershire Acute Trust has launched an investigation into a £1 million payment for bowel surgery at a private clinic run by its consultants. The payments were to treat patients that could not be dealt with in time at the hospital. Although there's no suggestion of wrongdoing, surgeons Stephen Lake and Steve Pandy didn't declare an interest until 2015, and the contract was never put out to tender. I'm joined now by our health correspondent, Michele Paduano. So why have there been concerns about this contract?
It's important to say, first of all, that the £1 million was over 3 years and it was paid through another company, Spire Healthcare. But the reason there are concerns is that because before, bowel surgery was done at both Redditch and at Worcester, and a decision was taken to concentrate services at the Worcester Hospital. Now, these two, Steve Pandy and Stephen Lake, were involved in that discussion about the concentration of those services, and they also set up their own service, their private surgery, at that time. So there is this idea that they may well have benefited from those changes, and the Save the Alex campaigners worry that the closure of the Redditch Hospital was for that reason.
So what has the Trust said about all of this?
Well, the Chief Executive, Steve Tidman, has released a statement. He said the two consultants are aware of the concerns and have assured us that there have been no wrongdoing on their part and have agreed to fully cooperate and participate in the investigation. As a matter of record, both consultants declared an interest to Worcestershire Acute Hospital's NHS Trust in 2015. We've not been able to trace any formal declaration of interest from either of the consultants prior to this, but this doesn't necessarily indicate any wrongdoing. Again, this will be further examined by the independent review. And he's also said that this centralisation of services was mainly for safety reasons.
Now, is there a wider issue, would you say, with the way consultants are paid?
Well, there is, because obviously all hospitals are struggling with waiting lists, and the same surgeons do the work in the public sector and in the private sector. And, for example, in Gabon, the orthopaedic hospital there, most of the consultants are involved in a group that does that private sector work. Now, clearly, what's the incentive of getting your NHS waiting list down if you're not then going to get the work in the private sector? And as we privatise more, clearly that's going to be an issue.
Michele Paduano, thank you very much. Now,